Welcome everyone. Thank you for being here. Today I'm going to present what do we know about the transition, two perspectives to better understand discontinued gender transition among youth. I'm Pullen, Professor of Social Work and Canada Research Chair in Transgender Children and Their Families at the University of Montreal. So before I start, I just want to acknowledge the research team. And to say that the research team is composed of cis and trans and non-binary researcher, as well as clinician, and one young person who has discontinued a gender transition, who act as a consultant to the team. Many of the team members are members of WPATH. And so we got the funding from the Social Science and Humanity Research Council of Canada Inside Grant Program. So the aim of the project is to better understand the phenomenon of detransition by analyzing discourses of youth, media, and health professionals. Today, I'm going to present you youth discourse on the evolution of their gender identity and gender throughout their transition and detransition journey, as well as some of the professionals' observation. So the methodology for the project is mixed, insofar that we've got 3 pilots. To understand the discourse around detransition, discontinuation, desistance. Why we've got those 3 terms is that when we started the project in 2019, we're still discussing and debating about the meaning of those terms. So we did interviews with youth, survey with professionals, as well as a media analysis. These 3 pilot studies are in core in an understanding that gender is fluid and non-binary. So I'm going to start by the interviews with youth. We did 20 semi-directed interviews and participants were aged between 15 to 25 years old. We recruited them on social media, such as Reddit and Twitter and Facebook groups. We went to groups for non-binary people, as well as groups of people who detransition or detrans group. The young people come from United States, Canada, France, Scotland, Finland, Germany, Belgium, and Indonesia. And the interview lasted between 68 and 116 minutes. The analysis, reflective, inductive, thematic analysis, and we used as well an adapted version of Saldana's longitudinal tool in order to trace the development of those themes that I'm going to present to you in a second. So these are the 4 themes I'm going to discuss today as far as the interviews with youth are concerned. So first of all, if we look at the youth affirmed gender identity, we can see first of all that the assigned gender, in our sample, we only have 1 person assigned male at birth. This does not mean much apart from the fact that it's a community sample. So when we were inviting people, only people who were interested were calling us back, emailing us. Therefore, we had more female assigned at birth. And so this is like a limitation of the sample. But what we can see here is that there's a diversity of identification all along the gender journey. So if we see that, before transition, we've got a different way of identifying themselves. There's some blank when we didn't have that information clearly in the interviews. And then we see that during transition, many identities are trans, but not all. Some have tried different labels. And now the gender identity are varied. So we can see here that we have youth who can ID as detrans, some other identify with their sex assigned at birth, and some other will identify with other type of gender or no gender anymore. Among participants, we can see that the identity is not fixed and it evolves, and it shows some fluidity of gender. For some, the change are in how they feel about gender identity, while for some other, the change are in the label they use. And so if we look, for example, at those 2 different citations, we can see here that for Dylan, it is really the way that they talk about their using, the label basically that they're using, whereas the other, Aaron, we can see that Aaron say that it's a change in gender identity. So if we look at youth sexual identity, we can see that there's been also some changes among the gender journey. So first of all, we can see that similarly to gender identity, there's a diversity along the gender journey, although we can notice that a lot of young people identify with sexual diversity. We can see that the sexual identity evolved, pointing towards a fluidity again. For some, they change in attraction. For example, Eleanor, so they went from attracted to male to bisexual, think possibly lesbian. And for other, it's basically the word that changed. For example, Yael, attracted to girls, and today still identify as, tapette, which is the word that the person used. If we look at the relationship to gender norm, we can see that there's different trajectories and their relationship to gender norm evolve over time. What seems to be important in all of that is that many youth reported being gender non-conforming in different ways in their childhood and before transition. Then we also see there's some pressure to conform or perform a gender norm during or after transition, and some sort of discomfort around gender norm coming back now. We can see also that some are feeling a liberation from gender norm. For example, Billy here. So we can really see that Billy now say that it's natural to be masculine girl, different, and has given up gender role altogether. And now if we look overall, we see that some maintain somehow a conflictual relationship to gender norm and less gender pressure and more freedom to be their authentic self. And so here we've got again, some citation from the interviews. We see Sasha here. I definitely have been feeling more able to do feminine things since the transition. I don't know, that was a big thing that got me to transition in the first place as well. I think I felt boxed in by the femininity, and then I was boxed by this masculinity, and just kind of I'm done with it all. We also looked at the evolution of body or dysphoria along the gender journey. So we can see here that there's positive and negative experiences. The positive, we've put them in blue, whereas the negative, we've put them in red. And so almost all participants talk about the complex relationship they have with their body and the change over time. We see that at the start, being uncomfortable with their bodies is kind of quite the main theme, whereas over the course of their journey, they talk about experiencing some body discomfort. This was often interpreted as related to gender dysphoria, but sometimes also as a manifestation of other factors, for example, eating disorder, trauma, dysmorphia, or even physical condition. During transition, young people said in general that they felt a bit better in their bodies. However, at some point, difficulties such as being unsatisfied with the change or having increase of dysphoria started. And what we see is that now we can see that the relationship to body vary, but for many it will include again positive and negative experiences. Some mention being comfortable or more comfortable with their bodies, while others will have still dysphoria, and sometimes they will have developed some what we call reverse dysphoria. So it is a dysphoria that came as a result of the change during transition. So here you've got a citation from Nolan. I still look more masculine than I desired. And because of that, I would just be very insecure during transition, and I had lots of loathing about that and lots of frustration. I kind of didn't at the time necessarily think where would be better thing like that. I thought I would just go on these medication and then slowly resemble the cis women. And it just doesn't put you in this sort of third gender box that I wasn't necessarily prepared for. So what's important to remember about the data I just presented you about youth experience is that throughout the gender journey, we can see that there's a different diversity between participants. So different participants will have different journeys, different gender identities, sexual identities, and they also have different relationship to gender norms and body. And we also see an evolution and fluidity among participants, evolution of their relationship to gender norm and relationship to body or dysphoria. And there's also fluidity of identity. And so what we found in the interview, it echoes Exposito Campos et al. And show really that youth who detransition from a heterogeneous group, and their experience is diverse. So I'm just going to talk a little bit about the experience of professional, because we looked at, we did a survey to understand what they observe in their practice. So this is still part of the study that I was talking about with the 3 pilots. So this is the second part. And so the survey with professional, we had an online survey accessible through Lime Survey in English and French, open between September 1st, 2020 to January 31st, 2021. We invited participants to participate. We had an invitation to participate, that was circulated broadly among 37 international organizations and specialty clinics offering service to trans youth, Facebook group and listserv, including the World Association of Sexology and WPATH. What we did is to just send the invitation to participate in different clinics, and we sent it to responsible people on listserv and also on Facebook group like International Transgender Health. The data analysis was done through SPSF software, and the survey had 21 questions using different levels of measurement. And we looked basically at characteristics of respondents and their workplace. We looked at characteristics of their professional practice and experience with youth having detransitioned or discontinued a transition. So who participated? We had 147 professionals who participated in the survey, including 54 who completed 100% of the survey. To do the analysis, we used those who responded to 60% or more of the survey. So this is 61%, and this 60% included the specific question about the transition. 36% completed the survey in French, while 64% English. So they practice mainly our sample in psychology, although we also have medicine and other disciplines such as counseling and sexology, youth work. And they mainly come from the private sector and the public sector, some were community organization or other. You can see here that they come mainly from North America, and they are a group that has followed quite a lot of young people. So you see only 11.5% of the sample followed 1 to 10 youth, all the other followed 11 youth or more, and 44.3% followed 51 youth and more. So they are fairly experienced, and they have practiced for a long time, as you can see here, with the average 2 to 5 years old, 37.7%, 5 to 10 years old, 29.5%, and 10 years and above, 24.6%. So the experience with discontinuation and the approach, so we asked them what sort of approach they practice. And so you can see overwhelmingly our sample is 77% of people practicing gender affirming, 7% in Dutch approach, and 16% others. The other approach included, general psychotherapy. Nobody said they were practicing corrective therapy. Now, this is again important to say that this is a community sample, so it's not a random sample. So people who participated, they just did the survey. So it's possible that circulating among WPATH, listserv, and other listserv like that brought us like an overwhelming kind of response in gender affirming practices. So this does not mean anything else than just people who wanted to participate. But what I want to show you here, and again, we don't want to take any of the percentage, and that's why I didn't put any percentage, but I wanted to show that basically there are some professionals who encounter youth who discontinued in each approach. So we've got some in gender affirming, some in Dutch, and some others. And it doesn't mean, it's not because you've got more here than in gender affirming that is because there's more people who saw discontinued, because here we just have an end of 4 people. Yeah. So the range of youth followed, you can see that most of them have seen only 1 to 5 youth, so 52.4%, and 5% of them saw 21 youth and over. But most of them, if you see like the general, see either none or 1 to 5 youth. So young professional did not see a lot of youth. And so what they observed, we looked at that with them just to see, we asked them to respond to statement thinking about the latest situation that they observed. So these are just those who observe people, young people detransitioning. So when we asked them to think about their most recent scenario, 40% stated that youth returned to a gender identity congruent with their gender assigned at birth, while 25.7% mentioned that the youth did not re-identify to their gender assigned at birth, and 31.4% were unsure, saying that it was a bit like that. 52.9% did not report an expression of regret from young people who discontinued, while 41% said that they saw a bit of regret or some regret in the youth they were thinking about. If we look at family support, we saw that in their most recent discontinuation scenario, 50% of the professionals described that the youth's parent took time to accept and support the youth, and 20.6% said the parents did not accept it at all, and 26.5% said it was a bit. When thinking about a recent case again, 41.2% of professionals said that the parents had no doubt about their child's trans identity, and 67.7% observed that the family did not appear to have any pressure from the close circle not to allow the child transition. Furthermore, a large proportion of professionals, 61.8%, reported that no one in the family seems negatively affected by the coming out of the youth. So what is important to remember in the data I have presented about professionals pilot study? We see that professionals offer diverse observation about youth who discontinue, and just over 1/3 has never met any youth in their entire career. The majority, 52.4% of those who did meet a youth who discontinued only met between 1 and 5 youth. This finding seems to be coherent to recent study that have suggested that discontinuation is not frequent, but we must know that a large proportion of people who discontinue might not inform their practitioner or their clinics or their clinician. So it may explain why those clinicians did not meet any. So if we put these two studies together, what we would say is that at the moment, young people who discontinue a transition or a detransition constitute a very diverse group. Our data show that they follow a trajectory that are unique, even though some experience may be in common, and data from young people themselves as well as professionals highlight this understanding. So we saw that the diversity coming from both pilot studies. Thank you.